Welcome back, and as March is Colorectal Cancer Awareness Month, and here to help me talk about it is Dr. Charles Papp and Dr. Jennifer Ray with, it's CSGA, stands for Colorectal Surgical Gastroenterology Associates. Did I
Nice
get all
work,
that?
Dr. Rock.
You got it.
Yes.
All right, well, tell me, we're going to talk about prevention a little bit, but Dr. Ray, who might be at risk for colon cancer?
Everyone is at risk for developing colon cancer, and that's the important message, that at some point screening for colon cancer is going to be indicated at some point in your life. And for average risk patients, meaning no family history or other factors that might increase your risk, it's now age 45, not 50 like it was for so many years. So that's really the message that we're trying to hit home.
Now, you told me earlier too that you're seeing a lot of younger people with colorectal cancer.
Yes, and that was the basis for the guidelines to change from age 50 to age 45, that really in younger patients, the incidence of rectal cancer specifically is on the rise.
Okay, now Dr. Papp, are there symptoms that you might, I mean, everybody ought to get screened, and we'll talk about that, but are there symptoms that might think, oh, something's going on here?
The tragedy we have is so many people feel that if they have bright red rectal bleeding, it's got to be hemorrhoids. And unfortunately, that's not always the case. It could be bright red rectal bleeding as a sign of cancer. It could be dark blood that's a sign of cancer. It could be a bowel change, an unexplained abdominal discomfort or pain. Any of those things that are a change or something new should be investigated.
Okay, well, let's talk about screening, Dr. Ray. Is there a certain procedure that you do?
Sure. I do perform a procedure, colonoscopy, for screening for colon cancer. That's the gold standard exam. However, there are other less invasive tests that can be performed, such as fecal occult blood tests, Cologuard, a FIT test. Those are checking for hemoglobin, blood in the stool, and with the Cologuard, some DNA from polyps as well.
Well, if you do one of the other tests other than colonoscopy and you do have a positive test, you end up with a colonoscopy anyway.
Yes.
Follow up. So Dr. Papp, it's not only, a colonoscopy is not only a screening, but it can be a prevention and a treatment all in one.
You're exactly right. As a matter of fact, since colonoscopy started back in the 80s, we've seen a decreased incidence in colon cancer. And actually, in this last decade, it's almost been a 1% decrease. And a lot of that has to do with the fact that colonoscopy is finding precancerous lesions, which we call polyps, and removing them before there's an opportunity for them to become cancer. Now, unfortunately, as Dr. Ray was mentioning, we're seeing a little bit of a disconnect because we're seeing younger people with colon cancer. So we're seeing a trend for the older patients of it declining, but we are seeing now a little trend of the younger patients increasing.
Well, Dr. Ray, you mentioned starting younger. You start at 45, and then how often do you do a colonoscopy?
If the colonoscopy is clear, meaning no polyps, and there's no family history of advanced colon polyps or colon cancer, then we can give a 10-year pass for a follow-up colonoscopy. But the recommendations for follow-up, if there are polyps or other findings, poor prep where we can't get a good look at the colon, or anatomy is difficult where we can't get a good look, we may bring patients back sooner than that 10-year interval. So it's a real individualized treatment plan based on the patient.
All right, Dr. Papp, tell me a little bit about a colonoscopy, and I got to start out with the prep because that's what my patients complain about the most. They really just hate the prep. Any way around it?
You are exactly accurate. The prep seems to be the most disliked part of the procedure, which in my mind, if it's the prep that's the part that's most disliked, then there's no reason really to fear the procedure itself. We have a lot of patients out there that say, I'm never going to have that done. It's terrible, it's awful, and it really isn't. The prep does involve having to take a fair amount of one type or another flavored liquid and water, sometimes a few pills, to try and get the colon clean. And it makes sense because if it's occluded with material, you won't be able to see the detail you need to do an accurate examination.
An uncomfortable prep is a small price to pay for prevention of a colon cancer.
Exactly. And by discomfort, the vast majority of patients say, well, you know, I was busy because of the prep, maybe a little bit of mild cramping, but most people don't say it was hideous or terrible. It was just a bridge to cross. And then once you get into the center to have the colonoscopy, people are pleasantly surprised at how easy it goes.
And he mentioned the center. You do it right there in your center. It's a quick procedure.
It is. Usually it's an average of 2 hours door to door. The procedure itself takes about 20 minutes to perform in general. And it's worth mentioning there's also an FDA approved PrEP that's all pills now. And so a lot of patients have had experience with the liquid that they are not excited about, and they've been asking for pills for a while. So now there's one that's safe and effective, which is exciting.
You're going to get calls about that.
Yes.
All right. Thanks you guys for coming in. And if you haven't had your colonoscopy, make sure you talk to your doctor about getting scheduled. We'll be right back.